I guess what I would say is, first of all, we expect and anticipate each time we move to a new phase that there will be some bumpiness. There has been every single time in Phase 1, Step 1, and Phase 1, Step 2, and Phase 2, Step 1. And I wish there was some way to avoid the bumpiness. Unfortunately, I think because a lot of the guidance is pretty detailed and pretty specific, I think it requires a few days for people to absorb it and understand it. And if people felt that that this guidance was late in arriving, that's certainly on us. With respect to the rules generally, and I should let the Lieutenant Governor add to this, we spend a lot of time talking to our colleagues in other states about the guidance that they're developing, who they're talking to, and how they're framing what they're doing, and have incorporated in many cases the guidance that we develop with the input that we get from our colleagues in other states. And what I've ultimately concluded is that there are different things on which every state is more strict or less strict than other states. But typically what people focus on, and it's totally understandable, is the circumstances and the particulars in their state on their issue where their state is more aggressive than another. But generally speaking, you know, it's one of these when you look at the actual layout of how different people have chosen to pursue this stuff. And some of it also just depends on whether or not there is a robust dialogue that takes place between and among the public health folks and whichever particular part of the economy we're working on. And generally speaking, that also has something to do with why some of this takes a little longer, because we work that hard. And I think I should let the Lieutenant Governor speak to that issue.
As we all know, Phase 3 of Step 1 began on yesterday. And as part of the opening of Phase 3, the guidance relative to youth and amateur sports activity was updated. This is a challenging area, but like industry reopening, sports also has levels of play as well as an assessment of risk associated with the individual sport activity. Much of what we've learned comes from what's happening in other states, comes from the CDC, and there's actually a National Association of High School sports that we've also looked to for some guidance. Many of these states that are opening sports have bucketed them in terms of low risk, moderate risk, and high risk. You see that in the guidance that we issued yesterday, and also talked about level of play. Level 1 being a practice with distance on the field, which was part of Phase 2. Level 2 allowing more play intra-team, so teammates playing one another. And level 3 being inter-team, so two different teams coming together, and level 4 being tournament play, where teams come from out of state and within a region. The guidance yesterday is for summer sports only, and it takes into consideration the level of play and the risk associated with the sport. We are also working with officials in the sports community as well as the medical community, and have organized an internal work group along with our professionals inside government to study what's happening elsewhere and determine what the next steps can be for the current summer, but more so looking at the fall and seeing what can be developed for fall sports. Thank you.